Hi everybody, welcome back to a couple of minutes in pediatric neurology with me. Today we're going to focus on a very common neurological condition which we come across called febrile seizures or febrile convulsions in children. Febrile convulsions usually occur in children between the ages of 6 months to 6 years. It can be very terrifying for parents who are coming across with children or who have children who have febrile seizures, particularly when it happens for the first time. The febrile seizures seen in children are between 2 to 5% in the world population. And the good news is that usually the children are developmentally normal, and it's not that they have epilepsy when they have febrile seizures. The seizures usually start during or after an intercurrent illness, for example, runny nose, cold, and then they have fever, and following which the seizures start. We usually divide them into two types of febrile seizures: simple febrile seizures and complex febrile seizures. Simple are when they are short-lasting, the whole body is involved, the child is completely well before the seizure, and when the seizure stops after some time, they're back to their normal self. We call it complex if they are long-lasting, which is usually more than 15 minutes, or there are multiple episodes during the day, or if they have what we call as focal seizures, which means one side of the body is involved rather than the whole body. When that happens, we have to look at the child carefully to look for anything underlying, like a central nervous system infection, which could cause complex febrile seizures. As I said before, mostly these are self-limiting, benign condition. Although the seizure may look very daunting and very terrifying, but children usually recover from them very quickly. And most babies or most children have few episodes during their lifetime, and they don't happen again. Usually febrile seizures are also seen in the families who have children with or other family members with febrile seizures. When a child starts to have seizure, it's very important that the parent or the carer does not panic. I know it's easy to say, but that's very important. How to care for a child who's having a seizure, you can go back and look at my videos in the past, which I've done on retodiazepam and midazolam. If the child has a febrile seizure, please make sure you call the ambulance and get them to the hospital to be seen by a specialist pediatrician or a neurologist to ensure that your child is okay. If you have any more queries or questions, please don't hesitate to drop a line, and I'll be more than happy to answer you. Thank you very much.